Hello, I'm Veronica Sanders. I'm a student nurse practitioner with Maryville University.
Yes, ma'am.
And I'm going to be doing your examination today. But first, I want to wash my hands. Okay, perfect. I'm just going to ask you a few questions. I'd like to identify you by taking a look at your ID bracelet. Can you tell me your name?
Carly Miller.
And can you tell me your date of birth?
December 15th of 64.
Okay, great. And I'm going to ask you some more detailed questions. Can you tell me where you are?
I'm at Dr. Shell's office.
And can you tell me today's date?
It is April 30th.
And can you tell me why you're here?
A physical examination.
Okay, so the patient seems to be alert and oriented ×4, and she seems to be dressed appropriately prior to coming in for the weather outside. She seems to be very much appropriate for her age, as well as she doesn't seem to be in any distress or have any labored breathing.
Okay.
So for this video, for the purpose of this video, we're going to do your vital signs. We'll check your height and weight. We'll also check your blood pressure, your heart rate, as well as your breathing.
Okay.
And then we'll go into the physical examination. So do you feel comfortable in the room?
Yes, I do.
And I see for this video you have disrobed, so we're going to examine you underneath the robe. Also, do you need to empty your bladder?
I already did.
Okay, wonderful. So we will get started, and I'm going to assist you down over to the scale here, and just step up here, and we'll take your weight. Okay, perfect. And now you want to just be careful turning around there, and you have your shoes off there, so that's great. Stand nice and tall for me. Okay, and now if you want to step down, and I'll assist you to step down. Okay, perfect. And now you can have a seat back here. Okay, great. So I'm just going to generally take a look at you to inspect you to see how your skin looks and feels. And so as I do the examination, I will be coming into your personal space. If there any time that you feel some pains or discomfort, please let me know. But let me ask you a few history questions. Can you tell me about your health? Are you in good general health?
I'm in good health.
Okay, and have you had any childhood illnesses?
No.
Anyone in your family, your mother, father, sister, brother, have any illnesses?
No.
Okay, and do you have children?
Yes.
And how many children do you have?
2.
And how many pregnancies did you have?
2.
Okay, perfect. And can you tell me when your last menstrual period was?
1989.
Okay, wonderful. And so do you come to have any examinations with a physician? With the doctor?
Yes.
Okay, and do you do self-breast exams at home?
Yes, I do.
Okay, and so when you come into the doctor's office, they do self-breast exams with you and show you how to do those?
Correct.
Okay, perfect. And so during our physical examination, I'm going to take your vital signs, so we'll proceed with that now. Just relax. Okay, great. All right, thank you. So I'm going to check your heart rate. You just relax your arm down to the side, and I'll check your respirations at the same time. To make sure that it's 1 minute. Okay, great. Now I'm just going to take a look at you generally overall. Okay. So your skin seems to be nice and intact. It's nice and pink. I don't see any jugular distension. Your thyroid and your trachea seems to be in midline. Your shoulders are nice and even. You seem to be sitting upright and erect without any discomfort. And your feet are pretty much relaxed there. So now I'm going to go ahead and step into your personal space, and I'll begin just examining you. And I'm just going to take a look at your head here.
Okay.
Your head seems to be normal cephalic. There are no lumps or bumps or masses. I don't feel any lesions at all. Your hair seems to be evenly distributed. I don't see any netting or anything that looks outside of normal there in your head. Have you had any trauma to your head before?
No.
Okay, so now I'm going to take a look at your eyes, but first I'm going to just touch to see how your skin feels. Everything's nice and warm and pink. It looks appropriate for your age there. So now I'm going to examine your sinuses. These are your frontalis sinuses. Are there any pains or pressure there? Any tenderness at all there as I press
No.
to your sinuses there? Okay, everything seems to look very well. So now I'm going to have you close your eyes for me. Okay, and open your eyes and raise your eyebrows for me. Okay, good. And so now I'm going to take a look inside your conjunctiva. Your sclera is nice and white and pink. There doesn't seem to be any trauma. Your conjunctiva is nice and pink and moist. Also, your lacrimal ducts seem to be nice and evenly distributed. There's no excessive discharge there. So now I want you to look down for me. I'm just going to look underneath your lower eyelids. Everything seems to be nice and pink and moist there. Okay. So I'm going to take a look inside your eye with this little instrument that has a little light there.
Okay.
But first, before we do that, let me do the cover and uncover test. So I want you to cover your right eye and uncover your right eye. And your left eye, cover your left eye and uncover your left eye. So you have good accommodation, okay, with that. So now I would like for you to take a look at this vision chart. I'm going to step back a little bit. And in the vision chart, I want you to tell me what's the lowest line you can read there.
It's LTFFM.
Okay, great. That reads 20/20, meaning that you have 20% vision at a distance of 20 feet.
Okay.
And so, do you have any corrective, like contact lens, or do you wear glasses?
No.
Okay, great, perfect. Okay, I'll write that card here. So now I'm going to take a look inside your eye with this little light here, and I'm going to adjust the lights here in the room. So I'm going to do the 6 cardinal of gaze, and so I want you to follow this instrument here that has the light on it there. So if you look in the distance there but follow the light, that would be great.
Okay.
So follow the light for me. So now I'm going to take a look at the inside of your eye. So I want you to look in the distance there beyond me. All right. Your red reflex is appearing. Your macula is good. It shows a little bit of yellowness, but no distress. And your sclera is nice and white there. Look at this side. Normal. All right, can you adjust your eyes? Everything is comfortable?
Yes.
All right, now I'm going to take a look at your ears.
Okay.
And we're going to do some hearing tests as well. So the first thing I'm going to do is just look at and inspect there, just making sure that your ears are in line, they're symmetrical, and they are in line with the outer canthus of your eye there, so everything looks good as I look there. Now I'm just feeling for any masses. I don't see or feel anything. Have you had any trauma to your ears before?
No.
Okay. So now I want to perform the test to just check your hearing. And let me know when you stop hearing the vibration.
No.
Okay. That was the Weber test. Now we're performing the Rhine test. And tell me when you stop hearing the vibration.
Stop.
And tell me when you stop hearing the vibration.
Stop.
And now we'll check the other side. Tell me when you stop hearing the vibration.
Stop. Stop.
So it appears to be that bone conduction is greater than air conduction. So that's normal.
Okay.
So now I'm going to take a look on the inside of your ear. I'm going to pull up and back for the adult ear. So I'm looking at your tympanic membrane. It's pearly gray with a focal of light at approximately 7 o'clock. There are normal hairs. There's very low cerumen in your ear, so everything looks good. No drainage or any pain or tenderness as I'm examining your ears. Are you experiencing anything?
No, I'm not.
Okay, perfect. So up and back again. We're taking a look at your tympanic membrane. There's a little bit of cerumen there, but you've never had any problems with waxy plugs or anything in your ear? Okay.
No.
And it's just showing your tympanic membrane is nice and pearly gray with a focal of light at approximately 5 o'clock.
Okay.
So that's great. So now I'm going to take a look inside your nose.
Okay.
And so I'm just looking to make sure that your nose is in alignment. Have you ever had any trauma to your nose at all?
No.
Do you get nosebleeds or anything like that?
No.
Okay. So your septum is in midline there. I'm just going to take a look at your nose. So I want you to actually hold your head back a little bit, and I'm going to just press on your tip of your nose there. And we're just taking a look on the inside. Everything is nice and moist and pink inside. Your turbinates are in midline. They don't seem to have any protrusion. Do you have any problems breathing outside of your nose there? Okay.
No.
Great. Same here on this side, nice and moist there. I don't see any evidence of any excessive drainage or any purulent drainage there.
Okay.
So the next area that we're going to examine is your mouth. So I'm going to take this little light here, and I want to just examine and take a look at the inside of your mouth. So if you just open your mouth there for me, I'm just going to shine a light here. Okay, and I see that you have all of your teeth. Have you had any problems with dental caries or anything like that? Okay, great. All right, so now I want you to lick out your tongue for me. I'm just going to take a look at your tongue there. And now we're just going to take a look at the back of your throat. Your soft palate and your hard palate have come together nicely, and they are appropriate. Now lick out your tongue and say ah.
Ah.
Okay. And then I'm going to just do a gag reflex there. Here we go. Okay, there. And now what I want to do is examine on the inside of your mouth. I'm just going to slip on some gloves here. So open up your mouth for me. Okay, and now lick out your tongue there. All right, and I'm just going to take your tongue, just going to move it to the side, and then I'm just going to examine. I don't feel any lumps or bumps, anything on the side there. Let me look at your buccal mucosal there. I don't see any trauma or anything there, so that's good. Okay, so next I want to take a look at your lymph nodes just to make sure there's no swelling or any protrusion with your lymph nodes, and let me know if you have any discomfort. So your preauricular lymph nodes are here, your postauricular lymph nodes are here, your superficial cervical lymph nodes, your tonsillar lymph nodes, your submandibular lymph nodes. Pull your neck down a little bit from your chin. That's good. Your submental lymph nodes are really good. Your deep cervical lymph nodes are good here. I don't feel any type of lumps or bumps or masses. And then your supraclavicular lymph nodes are here. So everything seems to be fine there. I do not feel anything that's out of the ordinary there. So now I'm going to come behind you. I've got one test with your ears, and it's called the whisper test. If you would take your finger and just close that up for me, and I'm just going to say a word and you repeat that word. Okay, and now plug your other ear for me. Okay, great. So I think that your hearing is pretty good there. So now I'm going to take a look at your thyroid and your trachea, make sure that's all in alignment there, and everything seems to be really good there. I'm just going to feel here, make sure that your skin is nice and warm, not moist there. Okay. And I'm going to come behind you, and I'm just going to press a little bit with firmness there, and then now I'm feeling for your trachea, and everything seems to be in midline. I don't feel any masses or lumps or bumps. I'm just going to move your trachea over and then just feel for your thyroid, and that seems to be nice and evenly distributed there, and I don't feel any masses there. And so as I'm looking at you, I want to take a look at your chest to see how it rises and falls. Okay. And then we're going to, of course, listen to your lungs, and I'll be listening to your lungs from the back there, and then we will also listen to your lungs in the front, and then we'll listen to your heart, okay? Okay. But I want to sit the chair up a little bit when we do your heart, not just now. So just trying to think through this process here. So what we're going to do now is I'm going to take a look at your chest, I mean your back, I'm sorry, your back here. And I'm going to feel for your bony prominences here. Any uncomfortable areas here?
No.
Okay. And so now I'm going to palpate these areas. Any area of discomfort there?
No.
Okay. All right, great. And so now I'm going to listen to these areas, okay?
Okay.
And as I press down with the stethoscope, would you take in a deep breath for me? Let me know if you get a little lightheaded, okay? Breathe out. Deep breath. Okay, and now you can breathe normal. Great. Okay. Everything seems to be nice and clear. I didn't hear any rales, bronchi, or wheezing there. So now what I'm going to do is a expansion test. I'm checking for your diaphragmatic expansion. Okay. And I'd like for you to take in a deep breath for me. Okay, and relax. And a deep breath in. Okay, relax. Okay. And everything seems to be expanding normally. I also, as I was looking at your posture, I was looking to see that your anterior posterior thoracic, it is less than your lateral thoracic, so that looks great there. So now I'm going to perform this test called tactile pharyngitis, and what I'm going to do is just be pressing my palm of my hands on your back there. Okay. So I want you to say 99 as I press in. Say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Okay, great. So that seems to be okay. Now I need to measure, and one way that we measure how your diaphragm expands, it's called diaphragmatic expansion, and so I need to measure your back here. Okay. And so how I'm going to do that is to percuss here, And for the sake of the video, of course, she does have a robe, so we're going to keep her robe on, but I will measure here, and I'm just going to tell you how I'm going to measure that. So I'm looking at the costural vertebrae, and so where that ends, I do hear some dullness, and so I'm going down till I hear tympani, and as I hear the dullness, I'm going to mark, and then as I hear the tympani, I'm going to go back up until I hear dullness again. And that measurement is going to be between 3 and 5 centimeters. And that's how we do the diaphragmic excursion. Okay. So now we're going to just examine your chest here. Okay. And then I'm going to listen to your lungs in the chest area. So I'm just briefly examining and looking with my eyes here. And I see that your breathing is even. So what I'd like to do is just press down on your shoulders. Can you shrug your shoulders for me? Okay, good, great. And so, and I'm also going to examine for your infraclavicular lymph nodes, and I don't feel any nodules or any masses there. So just taking a look at your chest here and how it rises and falls nice and even, and everything seems to be in midline. So what I'm going to do is just listen to your lungs here. Take in a deep breath for me. Deep breath. Breathe normal. Okay, and I didn't hear any rales, rhonchi, or any type of wheezing at all. So now we're going to perform the same expansion, diaphragmic expansion, as well as the diaphragmic or pharyngitis there. Okay. So I'm going to just place my hands here, and now I want you to take in a deep breath for me. We're going to check your expansion here. Okay. Breathe in one more time. Okay, good. Great. And your expansion is good in the front. And now say 99.
99. 99. 99.
And
99.
Okay, great. So that seems to be in symmetry, so everything is good.
Okay.
So what I'm going to do is raise the bed up at a 45-degree angle. Let me see if I can get the back up here. And then I'll get your feet up too. Okay, perfect. So come up on your feet there. I want you just to relax back here. Okay, now I'm looking at your jugular veins. There's no distension, no lifts or heaves there. And so now I want to examine your carotid pulse there.
Okay.
I'm using the bell of my stethoscope here. I'm just going to listen to carotids. I'm also going to listen to your thyroid. Okay, perfect. Now I'm going to listen to your heart. This is your aortic valve, which is indication for S1 and S2. Your Irv's point. And I know I want to listen to that for at least a minute there. Okay. So now what I'd like to do is just look at your arms.
Okay.
And everything seems to be nice and warm. I'm going to just check your the tinting of your skin to make sure that you have good skin turgor. And let me just take a look at your hands here. No clubbing on your fingertips. I'm just going to squeeze your fingertips. Your capillary refill is less than 3 seconds, so that seems to be appropriate. Now I'm going to take a look at your abdomen, and if you could just open your robe just a bit, and if you want to just pull your undergarment up just a little bit, just so that I can have access to your tummy there. And I'm just looking, your umbilicus is midline. Everything seems to be symmetrical. Can you tell me, do you experience any tenderness or pains in your abdomen at all?
No.
Okay, and how are your bowel movements? Are they good?
They're normal.
Okay, and have you had any problems with your bladder before?
No.
Okay, so I'm going to take a look before I actually listen before I percuss, because your bowel movements, your bowel sounds is what I want to listen to before I start to press on your abdomen, okay?
Okay.
So I'm going to listen to your aortic here. Okay, I'm going to listen to your bowel sounds here. In all 4 quadrants. And I do hear bowel sounds. I do want to listen for at least 1 minute. Okay. And now I'm going to actually percuss. You have to feel these areas now, so I'm going to palpate. You let me know if there's any sensitivity here. And I'm going to palpate with light palpations here. Okay. And now we're going to do some deep palpations. Any pain or tenderness in these areas? And now I'm going to percuss, and I have to percuss in order to find the border of your liver.
Okay.
So I'm listening for dullness and tympany. And what I'm going to do is I'm going to measure where I hear the border of your liver. There's dullness there. Measure from the umbilicus to midline clavicular. Here, dullness here. So we want it to be in between 6 and 12 centimeters. So you are right at 6 centimeters. So you have a good liver.
That's good.
Great. Okay, so now I'm just looking at your abdomen. So now I want to listen for the actual arteries of your abdomen, okay?
Okay.
So your aortic. You have your renal arteries, your iliac arteries, and I need to get a little bit lower. So we're going to do your femoral arteries. Here we go.
See my little donut.
So now your iliac arteries. And your femoral arteries. Okay, great. Now I need to palpate for your liver.
Okay.
So this is a deep palpation. And now your spleen. Now your left kidney and your right kidney. Okay, good. Okay, great. And so you can go ahead and get comfortable there. I need to take a look at your legs.
All right.
So take a look at your legs.
We're gonna get waxed.
Your hair seems to be nice and evenly. Your skin is nice and warm. Now I'm going to feel for your pulses.
Okay.
These are your dorsipedal pulses,
Okay.
your posterior tibial pulses, and your popliteal pulses. And I do feel those, and those seem to be nice and even. I don't feel any thrills or bruits. Same thing with your heart. I didn't hear any bruits as well. Forgot to say that. And so I'm going to lower your feet down, and I'm going to have you stand for me, because I want to take a look at your muscular skeletal and see that everything is going fine there. So comfortable there?
Yes.
So you can go ahead and fasten your robe for me. Okay, and I want you to just bend over a little bit for me. Okay. Can you touch your toes? Okay, great. And now stand back up. And so now face me. Okay. Can you puff out your cheeks? Okay. And can you smile real big? Okay. Can you close your eyes real tight for me? Okay, good. Can you shrug your shoulders? Okay, great. And now if you can extend your arms for me, just out to the side there. Okay, great. And then can you reach behind one at a time and touch your back? Okay. And reach behind and touch your back one at a time. Okay, good. And so now I'm going to have you turn around and walk forward for me. I'm just going to take a look at your walking. Just walk a couple of steps and then turn around and come back towards me. Okay, good. So everything seems to be good with your musculoskeletal system. You seem to be extending. I think that we're going to take a look at my findings during this physical, and we'll evaluate from there. So I'll go ahead and have you get dressed. It's
All right.
nice to meet you.
Nice meeting you too.
Okay.